So in the 17, what we are going to see, here we are going to see a comparison of lateral lemniscus, the spinal lemniscus, and the medial lemniscus. So find here. So this structure is what? This structure is our spinal lemniscus. So you can find spinal lemniscus in the whole midbrain. You see in both levels, superior and inferior colliculi, in the whole pons and the medulla oblongata. See here, this red structure is what? This red structure is our medial lemniscus. So you can find medial lemniscus in superior inferior colliculus and the total pons, but upper level of medulla oblongata. And this one I just talked about, lateral lemniscus. You can find the upper level, a little bit of the medulla oblongata, totally in the pons, and it will end in the inferior colliculus. Okay, and I hope you guys already know all these three lemniscus. Now focus in 18, what we have to focus. Remember, so it's written fourth cranial nerve nucleus and third cranial nerve nucleus. So third cranial nerve, as you can see here, is located in the level of superior colliculus, and the fourth is located at the level of inferior colliculus. Interestingly, you see from the third cranial nerve nucleus, the cranial nerve are emerging like this directly to anterior. So this is anterior, this is posterior. We are seeing the lateral view. But in case of the fourth, you see it's releasing posterior, then it's turning like this and coming like this. So this one, like this. Okay, if you want to be more specific, just say like this. Okay, so third cranial nerve is coming like this. The medial side of this interpeduncular fossa, and fourth is coming like this. Okay, so it's releasing from posterior, then it is coming lateral to the midbrain, then anterior. Okay, now let's come to 19th. You see here it is written medial longitudinal fasciculus. What is this? So you know third, you know fourth, you know sixth, and our vestibular. So our vestibular, you see, I just wrote down like this because it has four parts of this nucleus. So these four nucleus are connected via this fasciculus. Why? Because of eye movement coordination. Okay, eye movement coordination. So eye movement is a complex thing, and this all movements has very tightly interconnected via this medial longitudinal fasciculus. Claro? Okay. Now come to here. So this is our fifth nerve system. So fifth nerve system means, okay, fifth cranial nerve nucleus is very large. The first part you will find in the pons. Okay, in the pons you will find this part, and this part is our sensory, so principal sensory nucleus of trigeminal. Okay, principal sensory nucleus of trigeminal. Superiorly you will find this structure, okay, which can be found in level of superior colliculus and inferior colliculus, and this is known as mesencephalic nucleus of trigeminal. Claro? And it has another part which is going downward like this, and this is known as what? Spinal nucleus of trigeminal, which can be seen in the level of medulla oblongata. This is important thing, at which level you are going to find what. Now come to here. So now come to 21. 21 we will see periaqueductal gray matter. You know what I just talked about. You will find two particular nucleus. One is nucleus raphe, another one is central tegmental nucleus. Nucleus raphe, central tegmental nucleus. Claro? They release something. And what is this? Endorphin. Yes, this is a very sweet thing. Okay. Let's suppose this is our pain fiber, and to be more specific, this is our dull pen. Let's say the pain fiber is coming like this to the posterior or dorsal horn, ending up second order neuron, crossing contralaterally to the laterally, a lateral white column, then moving upward like this. Then it is ending up to our thalamus, to be more specific, VPL, then it's going to our cortex. Now say this is the normal pain structure. What happens sometimes, it gives some branches at the midbrain level, or some higher branch is coming downward to stimulate this nucleus. Okay, these two pairs of nucleus. So central tegmental nucleus and nucleus raphe. Again here, central tegmental nucleus, nucleus raphe. What happens, you see these descending fibers are going downward like this from both directions. And you see what happens, focus in this one. You see here is one synapse, they inhibit the synapse. So this is kind of inhibitory in nature. Okay, so if it is inhibitory in nature, what will happen? If there is no impulse flow, then there will be definitely no pain. Yes, so this is kind of painkiller, and this is a physiological painkiller, or we say pain modulation. Okay, this is our last part, maybe. Let's say this is 22. What we are going to find here? Here we are going to focus about the peduncular nucleus, interpeduncular nucleus, which is related with eating behavior. First come first, we'll do this. So here we will find superior colliculus and here we will find inferior colliculus. So interpeduncular nucleus is found at the level of midbrain, at the level of inferior colliculus, not superior colliculus. Claro? Okay. If you are done with this, you know, let's see, this is our thalamus, no doubt about that. You guys already know the lateral structure of the thalamus, you know, the lateral structure of the thalamus. If I try to draw like this and I say you guys, do you know? Yes, you guys know. So what are these structure? So this is thalamus, this is third ventricle, this is internal capsule, antiform nucleus, external capsule, claustrum and insula. It's very easy. Now always remember, antepost, there is some structure anteposteriorly present. Okay, if it is anterior, this is posterior. Anterior, always remember, thalamus is associated with this hypothalamus. Okay, so thalamus, hypothalamus. Anteriorly, thalamus, hypothalamus. Remember this. And inferior to the hypothalamus, this is pituitary. Yes, remember this basic concept. Now see, what is our input? So posterior, so this is our hypothalamus, no doubt. So from the posterior hypothalamus, you see some fibers are coming to the posterior side of the thalamus. And in the posterior side of the thalamus, you see this particular nucleus, and this particular nucleus is what? Habilinar nucleus. And the fibers then coming to the midbrain to a particular nucleus, which is our interpeduncular nucleus. Yes. So which is related to what? Eating behavior. Okay. Now if you want to know more details, see here downward, you will see this habilinar nucleus and this interpeduncular nucleus are connected with fasciculus retroflux. Okay. Okay. Now let's move to 23. Reticular formation. I have talked about lots of time. So this is our midbrain. So you will find reticular formation in the midbrain. So again, so this is the whole reticular formation, right? And you can find this ascending tract. So reticular formation mainly contain the ascending tracts because it is located in the posterior system. Okay, so contain the ascending fibers. Now come. So you will find reticular formation in midbrain. You will find reticular formation in pons, and you will find reticular formation in medulla oblongata. Claro? Here is one note information. If you somehow damage the reticular formation, you will be in coma. So this is one of the cause of a person going in coma. Now let's come to 24. Simple. So you have to know what is central tegmental tract. Again, central tegmental tract. It is a complex tract. Just know the name and location. Okay. So there is a mnemonic here we'll just talk about. So firstly, you will find this tractus solitarius nucleus. Okay. So this tractus solitarius nucleus from here, which is located again at the level of, you see, you can say junction or just superior to the medulla oblongata or at the below level of pons. It's going upward like this and end up to the thalamus and where ventro-postomedial nucleus. One track is done. Now see again, you see this red nucleus, and this red nucleus, you know, again superior colliculus level, giving a downgoing fiber like this to our olivary nucleus, and you know the olivary nucleus location and steps. So focus here, it is a rostral tract. So rost, R for red nucleus, O for olivary nucleus. Claro? So S for solitary, T for thalamus. Done. Okay? And sometimes you can see some fibers are going, ascending fibers are going from this of the reticular formation to thalamus. You guys know this one. It is easy one. So this whole tract, this whole structure together is known as our rosted tract or central tegmental tract. Okay. Now come here. Substantia nigra. You know substantia nigra, but what to be more detailed? You see, substantia nigra has two parts. So this is substantia nigra. Substantia nigra has two parts. So inner side, so if this is anterior, not if it is anterior, this is posterior. In the posterior side, you will see pars compacta. Pars compacta means it will be a dense black, pit black. But pars reticularis, you will see light and black, like this, light and black. Now let's come to again. This is some very important points. Okay, come here. Again one. So red nucleus associated fiber. So here we are going to see what are the association or connection of red nucleus. Again, red nucleus is associated with sitting maneuver or flexion of your muscle. So let's say, normally we say, we know this one. This is our what? Corticospinal. or pyramidal tract from both sides. Okay, lower motor neuron like this coming innervating muscles. Right. Now see, you see from the cortex there are fibers like this going to red nucleus but contralaterally. Again, you see fibers are coming like this but moving contralaterally. Then what can happen? Then from this it can descend downward and can stimulate the lower motor neuron like this. And what will happen? You will sit down. Flexion. Sit down. Just remember, sit down. You will sit down. If red nucleus start firing, you will sit down. And if you want to be very good, remember, you just talked about this dento-rubro fiber or tract, and there are some connection with the nucleus also. And these connections are to be correction. Correction means in this complex movement, if there is any correction needed, so this nucleus will correct those movement. Okay, this is our last. So let's see here. Here we are going to talk about the superior colliculus connections. Okay. Superior colliculus, I hope you know superior colliculus is what. But what are the connection superior colliculus have? Okay, before that, remember, come down here and remember this fiber. Okay, we have frontal eye field fibers, we have occipital eye field fiber, we have a retinal fiber, and we have some descending fibers or say tectospinal fibers come in the diagram. So this fiber is coming from retina to where? To our superior colliculus. This fiber is coming from our frontal eye field to superior colliculus. This fiber is coming from where? Occipital eye field to superior colliculus. And now see, this fiber is coming from our ciliary muscles, first to ciliary ganglion. Then the second order fiber is coming like this and attaching to a particular nucleus. And this nucleus is located at the level of superior colliculus, and it is known as our Edinger-Westphal nucleus. Okay, Edinger-Westphal nucleus. Okay, now see which has some parasympathetic activity. Okay, now see, now let's talk about the function. You see this frontal eye field. This frontal eye field do searching movement of the eye, such as suppose if you are finding your wife in a crowded area. Okay, now you see we have this occipital eye field which is associated with tracking movement, such as you are looking a beautiful girl and you just cannot move your eye, it's just glued. So this is a tracking movement. Let's say it's claro. Let's move forward. So here you can see one nucleus we are going to talk about, which is a pretactal nucleus. Location. Okay, function is what? Pupil constriction. Okay, definitely this is our responsible for light reflex. If there is light, highlight, bright light, you will constrict. So this is the reflex. Now see, so first let's talk about what you know. You know these retinal fibers are coming like this. So this retinal fiber is coming like this to where first? Superior colliculus. Now you see, you guys know this red nucleus here is our pretactal nucleus. And this fiber give stimulus to our Edinger-Westphal nucleus. So it has both connections. And then from again this ciliary ganglion to here. Okay. So this is the actual pathway you have to focus. Before that, in the previous diagram, you can just make a correction. The actual pathway is in this direction. Okay. Because it is effect. This is an effect. Okay. So this is how actually the pathway of pupillary contraction works, or to be more specific, reflex. Let's move forward. You have this one. This you guys know this nucleus is what? Pretactal nucleus associated with pupillary constriction. So this connection is known as posterior commissure. Important, posterior commissure, where located and what is the function? It's definitely the connection between two pretactal nucleus. Let's focus in fifth. Here we have lateral geniculate body, and we will see what is the superior brachium fiber. Before that, let's remember we have here inferior colliculus. Inferior colliculus. If you guys remember, we just talked about a lateral lemniscus, then we talked about it release an inferior brachium fiber, then medial geniculate body, right? Something like that, which is associated with hearing. Now see, again, the upper fibers which are coming from cortex, so let's say if this is our cortex, the fibers from the cortex are first coming to where? Lateral geniculate body, okay? And then from lateral geniculate body, fibers are coming to where? Superior colliculus. So you will say this fiber is what? Superior brachium fiber, and you know it is associated with our eyes, no doubt, okay? Okay.